Identifying the origins of cystic fibrosis lung disease. Introduction. The airways of patients with cystic fibrosis are susceptible to infection, which induces an intense inflammatory response even in those who with only modest pulmonary disease. Although they are often asymptomatic, infants with cystic fibrosis have neutrophilic inflammation in their airways, which is both protective and destructive. Neutrophil proteases, including elastases, are critical for killing engulfed bacteria, but these proteases escape from neutrophils during the phagocytosis and in death and subsequently overwhelm anti-protease defenses in the potassium effect of neutrophils and neutrophil elastin in the airway of patients with cystics.
Cystic fibrosis is a genetic disease that alters the body's respiratory, digestive, and reproductive systems. It affects the body's epithelial cells that comprise the lining of the lungs, pancreas, liver, sweat glands, digestive tract, and reproductive system. Normally, the epithelial cells release a slippery layer of mucus, captures dust and germs, and acts as a lubricant. A person with cystic fibrosis inherited a gene that causes the epithelial cells to produce a defective protein.
Defects. Neutrophil elastases accumulates in the airways of patients with cystic fibrosis, impairs ciliary function, cripples bacterial clearance, and degrades the structural proteins strongly leading to bronchiectasis. Peripheral airway obstruction and bronchiectasis often begin early and progress during the first few years of life.
That protein leads to the formation of thick, sticky mucus, which causes many serious problems. The sticky mucus can clog the bronchial tubes, interfere with breathing, causing coughing and wheezing, cause fatigue, interfere with digestion and absorption of nutrients, which can limit growth and weight gain and cause chronic diarrhea. Common symptoms of cystic fibrosis include persistent coughing, poor weight gain, bulky stools, and very salty tasting skin in infants.
Findings. Sadly, College 7 new report on the journal that presence of neutrophil elastic activity in the bronchoalveolar lavage. Fluid from 3-month-old infants with cystic fibrosis is associated with the persistent bronchiectasis, defining as delayed airways on the at least 2 sequential computer tomographic CT scans on the chest. This finding has important implications for the assessment of cystic fibrosis lung disease, clinical trial and endpoints, and potentially therapeutic intervention, although it is unclear whether neutrophil elastasis is central to early pathogenesis or is simply blood marker for early disease.
Treatment of cystic fibrosis varies according to the stage of the disease and which organs are affected.
Biomarkers. Markers of lower airway inflammation that are assessed by means of bronchoalveolar lavage and chest CT imaging. Though not without risk are the tools needed in the breath to assess the efficacy of certain therapies until less invasive measures are fully developed and validated. These blood markers of future lung disease could also provide direction of our therapeutic efforts in the youngest population. This is a video that is associated the pancreatic duct with cystic fibrosis.
The pancreatic duct with cystic fibrosis. The pancreatic duct epithelial cells in approximately 90% of people with cystic fibrosis have key differences with healthy pancreatic duct epithelial cells. Because of genetic mutations, the CFTR chloride channel is either non-functional or missing from the cell surface. This causes chloride to be trapped in the cell. Without the chloride movement out of the cell, neither sodium nor water can move into the pancreatic juice. This causes the pancreatic juice to become viscous. At the same time, The sodium channel is more active.
In conclusion, a more intensive and anticipatory approach to care will lead to better long-term outcomes and could improve the chances of survival of a child born with cystic fibrosis today.